I recently did a video answering questions about hiatal hernias. Let's go back to Google because there's a lot more. Does hiatal hernia cause burping? Burping is caused by swallowed air, and a hiatal hernia provides a pocket for air to accumulate above the diaphragm from where it can be easily expelled back up the esophagus, but the air had to come from somewhere. It was swallowed, and that occurs between eating or while you were eating. An evaluation called an esophageal impedance study can help determine when you're swallowing too much air, and diaphragmatic breathing exercises and slowing down your eating may help, but a hiatal hernia itself does not cause burping. Does a hiatal hernia cause back pain? Our insides don't really have a good sense of where they're feeling pain. This is called referred pain, and a classic example is a heart attack when people will feel that they've got pain radiating down their left arm or even up to their chin. And this is because the sensory nerves of these parts of the body are overlapping with the nerves of the heart. And the same phenomenon can happen with the esophagus. Usually esophageal pain is sensed just beneath the chest bone, the sternum, but it can also radiate to the back. So yes, a hiatal hernia could cause back pain. Does a hiatal hernia go away? The symptoms of a hiatal hernia can definitely improve with medication and lifestyle changes, and it may get smaller with weight loss, but it's best that weight loss be gradual. Bariatric surgery may be performed to help a person lose weight, but sometimes that leads to very fast weight loss and altered anatomy that can actually make a hiatal hernia worse. And so it's best that a hiatal hernia repair be done at the same time as a bariatric surgery if it's needed. And ultimately, surgery is really the only way to get rid of a hiatal hernia, but that only needs to be resorted to if medication and lifestyle changes cannot control symptoms. Does hiatal hernia cause nausea? Yes, unfortunately, a hiatal hernia can cause nausea. This probably occurs because a portion of the stomach resides above the diaphragm and it fills quickly, getting full. The vomiting that you're having may actually be a large amount of reflux from those hernia contents that never made it down into the larger part of the stomach but are refluxing back up. Can a hiatal hernia cause palpitations? Heart palpitations are very common, and as people get older, many will feel that they're having an extra or a skipped beat. This can be because of lack of exercise or overuse of alcohol. Hiatal hernia is also very common, and so it's not uncommon that the two occur together, but one did not necessarily cause the other. Now, it's conceivable that a hiatal hernia could be so large that it pushes on the heart and provokes palpitations. But this is very uncommon. I've seen many patients that have massive hiatal hernias where their stomach and other organs from the abdomen are actually up in their chest and they were not having palpitations. I've also seen patients whose esophageal sensitivity provoked heart rate changes. When they drank a cold drink, it slowed their heart, and that may be because their esophageal sensory nerves overlapped with the mammalian diving reflex. That's the reflex that when your face touches cold water, your heart rate slows. So while yes, there are reasons that a hiatal hernia or esophageal sensitivity could provoke palpitations, palpitations are so common and there's so many other reasons for them that really these being the cause of palpitations is very much the exception and hardly the rule. How to stop a hiatal hernia attack? If you are having worsening reflux, it is often a dietary issue. Now, if you've already eaten, it's too late to take a proton pump inhibitor. This is the time to take antacids, and famotidine can also be helpful in this situation. If there's a problem with the stomach twisting on itself, you're going to have sudden, dramatic pain unlike anything you felt before and unrelenting vomiting. This is an emergency and a condition called a volvulus. And we need to solve it by getting a tube down into the stomach to suction its contents so that it can relax. And at times I will need to perform an endoscopy so we can successfully get that tube in, and I can look at the stomach lining to see if it's still viable as a plan is made for surgery. How to diagnose a hiatal hernia at home? Well, you really cannot. It requires some form of imaging to see the hernia, and that needs to be accomplished either with an endoscopy or a radiology test. And when you have a large hiatal hernia, it's helpful to have both to get a complete view of the size and position of the hernia. And then while you can't do these at home, you can continue to be educated and entertained by subscribing to our channel to watch more videos about your GI health. Thank you and be safe.